I think every mother would say this. I mean, having children for me has been the most amazing, life-changing thing that's ever happened to me. Just the smells and the sounds and the buzz. I'm kind of addicted to the extremes, so I'm always, excited to be plonked down somewhere completely new.
The reason I've come here is to witness what positive effects government funding has had in providing free basic healthcare in Ghana and how it desperately needs to be continued, as well as being introduced into Liberia.
That way to see those who have delivered. That's where they are.
I'm in a really fortunate position to be able to leave my happy, healthy kids behind and come here and immerse myself in a completely different world. This is the kind of trip that wouldn't have made complete sense before I had children. When we leave the hospital full of mothers in labour and infants that the odds are against them, and then I get back in the car and call my kids on the way to school, it's actually really extreme, but actually it does reinforce why I'm here. Pregnancy and childbirth simply shouldn't be a cause of death in these times.
Meeting Aisha, we discovered how she had attempted a traditional home birth, but as complications grew, she managed to get to hospital for a successful birth. She was lucky. I would later discover in Liberia that these kinds of situations would inevitably end in the death of the baby, or in some cases, the death of mother and baby. In remote rural areas of Ghana, basic maternal clinics have been built to help improve the infant mortality rate.
So they were telling me he couldn't ride by a motorbike again. I said she must ride a motorbike in order to save something. Because if you couldn't save the baby, maybe you may save the mother. Especially it's common in this our area because from here to the district capital is a bit far.
You already knew there was no hope for the baby. It was just about the mother at that point.
No. Like if you have certain conditions like that, you know definitely if you don't act promptly, you may lose the two.
Yeah.
Yes. But if you act promptly, you may lose one.
Yeah.
If you lose the baby, it's better than losing the mother and the baby. The baby. And nah. Pastor Mata. Excuse me, yeah? You're going to deliver.
Okay. At least if one can go inside.
I found it really emotional, and I kind of had to try and let go of all my English reserve, which was kind of telling me that I shouldn't even be there in the first place. Very happy in this cocoon. Oh, I wasn't expecting to see a birth, let alone to be asked to name the child.
Keeps closing the curtain.
Yeah, it keeps closing. Congratulations.
No, I want a name from you so that they will use to remember that the day I was delivering, there were some white people who gave the name. Yes.
And I suddenly kind of stuttered George. George? And I just couldn't believe also the grace and of the new mother and the midwife. It was really moving.
Bye-bye.
She just had that kind of magic energy of somebody that's just devoted to her cause.
Although it's great that a facility like this exists at all, the building doesn't have electricity. So if this baby had been born at night, it would have meant the midwife working by torchlight. It seems like this clinic can cope with straightforward births, but in a crisis, there'd need to be a fast referral to hospital. It's obvious that potentially they could do so much more given the space and facilities.
Sadly, her baby died in labour, but
Even though that's a terrible tragedy and she's obviously grieving and recovering, the miracle is that she's still alive. If she hadn't had access to the hospital, I can't imagine there's any way that she would have been able to live through that. With the right care, she can rest, she can go on to have more children, she can at least have a sense of a future, and her other child hasn't lost her mother and her husband hasn't lost his wife. I think going home with time to reflect, I would feel confident to celebrate Ghana's initiatives with the free maternal health care, but with reservation, you know, with the view that there's a long way to go, that even though we met inspirational leaders and doctors, their work is still handicapped by a lack of resources and a lack of beds and space and trained experts.
We've got a live chicken in the back of the car, which Clara's going to take home for her family's supper. Wow. A gift from the chief. That's a high honour, Clara.
I felt in Ghana an infectious optimism. You want to believe it's improving. It's palpable, and it's not just through individual women's stories. It's on the street. It's, you know, you feel like change is afoot. Prosperity is possible. But at the same time, there's a long way to go. They're a good example of a country bringing down its mortality statistics, creating a model that, if not perfect, is definitely on the right path. Leading doctors and experts that we met definitely need their work to be supported and reinforced with government funding. They've kind of proved that they deserve further investment, further aid, because they're putting their ideals into practice.
My dream is to have a maternal and child health center of excellence, to build a center that will provide service, would also go into research. If we can do it in the northern region, it can be done anywhere in this country.
I think I'd ask the British government to look at the models they've created and look at ways in which they can further support their really huge positive steps in this area. My first impressions are that whilst Liberia are very ambitious to catch up with Ghana in some ways, they are nowhere near Ghana's level of healthcare. All the intentions are there, it's not happening now, and the statistics that we've heard in our initial briefings have been frankly shocking and depressing. We've been in the slums of Clara Town today and looking at a healthcare centre, which is, again, a valuable resource within a very, very deprived community where minimal healthcare can be provided, but drugs run out, doctors aren't available or elsewhere. I found that it's actually very hard to get a handle on what's available, how much healthcare costs, exactly who is entitled to what. There's no way that the place we saw today can meet the needs of the local population. And we actually found ourselves as a group battling the Liberian health system when a colleague suddenly fell sick today. And even though it wasn't a life and death situation, it was an emergency, and it was extremely challenging. We really had a shocking initiation into the problems of Liberian healthcare today, and none of us would want to be in an emergency situation in Liberia right now.
If someone comes like they are MP, about 8, 6, 7, 8 CMs dilated, we cannot send them to a hospital. They may not get car right away because there is no ambulance. So we let the patients wait, and we do the delivery right in there before we start to see patients because of no space.
It desperately needs support and funding to try and advance the system and make healthcare a right rather than a privilege.
Near me, after our mother. We not think about mother too much, we think about her. Each time we see her, we say that our daughter, Chadi.
We lost your wife. Now I asked about what was the reason. He said, well, when we performed the C-section, she bled so much that we couldn't able to control it. So she passed away. And that was it. There were two persons that performed the C-section. You see, a male and a female. I don't know whether they were medical doctors, but they did it. I don't know their qualification, but they did it. You know, after they did it, then that's the result that came out. And she was dead.
Do you think that 1,000 women a day die in pregnancy or childbirth? 350,000 a year? That's pretty hard to ignore. The death of a mother leaves a surviving child 3 times more likely to die before its 5th birthday. Liberia has plenty of ambition, but not enough medicines, doctors, nurses, or clinics. Ghana's progress is a sign of what Liberia could achieve with serious financial help from the governments of developed countries. The British government and wealthy nations around the world must help to ensure that countries like Ghana can realise their ambition of providing free healthcare, available everywhere and for everyone, not just the few who can afford it.